Week we heard very compelling and heartbreaking testimony from nurses in Massachusetts and public officials in Louisiana about how the financial mismanagement of Steward Healthcare and the greed of its CEO, Dr. Ralph Delatorre, caused devastating harm to patients, to healthcare workers, and to entire communities throughout this country. These courageous witnesses, members of this committee and the American people, deserve to know how Dr. Delatorre became extraordinarily wealthy while the hospitals he managed went bankrupt and could not afford to pay their bills, threatening the lives of patients and the safety of healthcare workers in many states around America. Unfortunately, the person who is in the best position to answer those questions, Dr. Delatorre, has repeatedly refused to appear before this committee. For months, this committee has invited Dr. Delatorre to testify about the financial mismanagement and what occurred at Steward Healthcare. Time after time, he has arrogantly refused to appear. On July 25th, the Health Committee authorized the investigation into the financial mismanagement of Steward Healthcare by a vote of 20-1 and authorized a subpoena for Dr. Delatorre's testimony by a vote of 16-4. He was ordered to come before this committee on September 12th. And as we all know, last week on that date, Dr. Delatorre made the unfortunate and unacceptable decision to not show up and to defy this congressional subpoena. Therefore, Dr. Delatorre has given us no choice but to move forward this morning on two resolutions to enforce the subpoena and to hold him accountable for his actions. I am very pleased that there appears to be strong bipartisan support for these resolutions, and I thank Ranking Member Cassidy and his staff for working with me and my staff on this very important issue. Today's bipartisan markup will make clear that even though Dr. Delatorre may be worth hundreds of millions of dollars, even though he may be able to own fancy yachts and private jets and luxurious accommodations throughout the world, even though he may be able to afford some of the most expensive lawyers in America, no, Dr. Delatorre is not above the law. If you defy a congressional subpoena, you will be held accountable, no matter who you are or how well-connected you may be. Why did we want Dr. Delatorre to testify before this committee? We wanted to know how it could happen that at least 15 patients at hospitals owned by his company died as a result of a lack of medical equipment or staffing shortages, and that at least 2,000 other patients were put in serious risk according to federal regulators. And perhaps most importantly, we wanted to know how it could happen that while thousands of patients and healthcare workers suffered and communities around this country have been devastated, Dr. Delatorre and the companies he owned were able to receive at least $250 million in total compensation over the last 4 years. Our goal has been to make sure not only that we understood the financial chicanery surrounding Steward Healthcare, but to do our best to make sure that such a travesty never happens again in this country. Senator Cassidy, you are recognized for an opening statement.
Thank you, Chair Sanders. For months, this committee, on a bipartisan basis, investigated the bankruptcy of Steward Healthcare and the impact of the delivery of care at its hospitals. This had nationwide implications. It affected patient care in more than 30 hospitals across 8 states, including Glenwood Regional Medical Center in West Monroe, Louisiana. I think Senator Romney also commented upon Utah being affected. Now, a thorough review of Chief Executive Officer Dr. Ralph Delatorre's management decisions is essential to understand Steward's financial problems and its failure to serve its patients. According to a report from the Centers of Medicare and Medicaid Services, a physician at Glenwood and West Monroe told a Louisiana state inspector that the hospital was performing third world medicine, quote, end quote. Because of management decisions resulting in limited resources at Glenwood, the state had to force the hospital to operate at 1/3 its capacity. One patient died waiting for a transfer to another hospital because Glenwood lacked the necessary resources to treat. Now, unfortunately, the problems at Glenwood are not unique. Audra Sprague, a nurse at St. Elizabeth's Medical Center in Boston, testified last week that because of understaffing, patients at St. Elizabeth's waited in the emergency room for hours and sometimes days for care. These delays further harmed patients, even leading to the death of a woman who had just delivered. We also heard that Stewart neglected to pay vendors for essential hospital supplies. At St. Elizabeth's, it was so poignant. When a newborn baby dies, normally the nurse would place the child into a bereavement box. They did not buy bereavement boxes, and the nurses had to put these newborns into cardboard shipping boxes. Hospitals like Glenwood are also essential for the health and financial well-being of the communities they serve. Glenwood was the largest employer in West Monroe and West Washita Parish, at one point employing 9% of the community. At last week's hearing, West Monroe Mayor Stacy Mitchell testified that since Glenwood began its layoffs, about 450 people have lost jobs at the hospital. Now, to better understand, and by the way, this is despite Glenwood still making money. To better understand and hopefully prevent it from happening again, we sought answers from Dr. Ralph De La Torre. This is what our bipartisan work has been about, answers for constituents to inform legislative solutions. Unfortunately, Dr. Ralph De La Torre refused to testify voluntarily. As a result, the committee issued a subpoena in July. Up until September the 4th, Dr. De La Torre's lawyers indicated he intended to comply with the subpoena and testify. However, 8 days before the hearing, Dr. De La Torre informed the committee he would not comply with the subpoena. We responded to Dr. De La Torre, explaining why his objections to the committee's subpoena had no merits, and directed him to comply. Unfortunately, he defied the subpoena and refused to appear before the committee last week. Now, a witness cannot disregard and evade a duly authorized subpoena. It's unfortunate we've got to this point. But if someone shows contempt for the American people by defying a subpoena and refusing to provide answers, that is contemptible. And we are here to represent the American people. It is not just Congress he is defying, it is the people whom we represent, and not just in our states, but nationwide. I appreciate Chair Sanders for his collaboration in this bipartisan investigation. I think it's important, not just in this incident, but to send a message to those in the future who might say, oh, we don't have to listen to Congress. We can stiff them. Nothing will happen to us. We will, if we do nothing here, have no way to compel those in the future who, on a different occasion, should provide answers to the American people. I urge my colleagues to approve these resolutions to hold Dr. De La Torre in contempt.
Thank you, Senator Cassidy. I think we're waiting for a few more members. Anyone want to comment? Senator Markey.
Thank you, Mr. Chairman. And thank you to Ranking Member Cassidy for your leadership on this issue. And thank you for pursuing this contempt charge. As the Boston Globe Spotlight team reported today, on September 22nd, 2023, Steward CEO Dr. Ralph De La Torre boarded a jet and flew from Dallas to Turks and Caicos. Only 9 days before, a patient arrived at Good Samaritan Hospital in Brockton, Massachusetts, with chest pain. The emergency room was understaffed due to Steward's financial chaos, and health providers could not get to the patient in time. The patient died 1 hour later. As a physician and as the CEO of Steward from its founding, there is no one who understood the potential consequences of Steward's failures more than Dr. Ralph De La Torre. Dr. De La Torre led Steward when they closed the only emergency department in Quincy, Massachusetts, and then converted it to luxury apartments. Dr. De La Torre led Steward when Neshoba Valley Medical Center closed and ambulance drive times quadrupled for the people in all of those communities. Dr. De La Torre led Steward when it sold out hospital property to Medical Properties Trust and private equity firm Cerberus, extracting $800 million in profit. That profit came from emergency rooms. That profit came from ICUs that were no longer operative to help people who needed it in those communities. And Dr. DeLatorre led Stewart as 8 hospitals closed, 2,000 patients were endangered, and at least 15 patients died. Dr. DeLatorre may try to shield himself from hearing from the people in Massachusetts and across this country that he hurt. But I hear from them, and I am with them. They are angry, and I am angry for them. The American people and my constituents in Massachusetts deserve to hear directly from him about how this disaster unfolded. But Dr. DeLatorre has made clear through his corporate attorneys, his lavish spending, and his failure to appear before this committee that he feels no accountability to the patients who died, the workers who Stewart fired, or the communities that have been left behind. Today, we are making clear to Dr. DeLatorre and the other CEOs, private equity investors, and corporate executives who treat the healthcare system like their own personal piggy bank, that your millions do not shield you from accountability to a legal order issued by the United States Senate. Dr. DeLatorre was under legal order to appear before this committee. Dr. DeLatorre violated that legal order. Dr. DeLatorre must be held in contempt of the United States Senate. Thank you, Mr. Chairman. Thank you, Mr. Ranking Member.
I think we have, thank you very much, Senator Markey. We have 11 members here, and I want to proceed because I know everybody has a busy schedules. We will now begin consideration of 2 resolutions. I will recognize any member wishing to speak after the votes, and I ask my colleagues to limit remarks to 2 minutes. However, we will take votes as soon as we have a necessary quorum in the room. If there are still members who wish to speak after the votes, I'll recognize them at that time. Today, we are considering a resolution directing the Senate Legal Counsel to bring a civil action to enforce a subpoena of the Committee on Health, Education, Labor, and Pensions of the Senate, and a resolution authorizing the President of the Senate to certify the report of the Committee on Health, Education, Labor, and Pensions of the Senate regarding the refusal of Dr. Ralph DeLatorre to appear and testify before the committee. I note the presence of a quorum, and we will now move to votes. Mr. Kirk? First vote. First vote is on final. Yeah, you want to know what you're voting on, right? All right, why not? The first vote is on final passage of the resolution related to civil enforcement. I move to favorably report the resolution directing the Senate Legal Counsel to bring a civil action to enforce the subpoena of the Committee on Health, Education, Labor, and Pensions of the Senate. The clerk will call the roll.
Senator Murray? Aye. Senator Casey?
Aye by proxy.
Senator Baldwin?
Aye by proxy.
Senator Murphy? Aye. Senator Kane? Aye. Senator Hassan? Aye. Senator Smith? Aye. Senator Lujan? Aye. Senator Hickenlooper? Aye. Senator Markey? Aye. Senator Cassidy? Aye. Senator Paul? Not voting by proxy. Senator Collins?
Aye by proxy.
Senator Murkowski?
Aye by proxy.
Senator Braun?
Aye by proxy.
Senator Marshall?
Aye by proxy.
Senator Romney?
Aye by proxy.
Senator Tuberville?
Aye by proxy.
Senator Mullen? Aye. Senator Budd?
Aye by proxy.
Chairman Sanders?
Aye.
I have 20 ayes, 0 nays.
The next vote is on final passage of the resolution related to criminal contempt. I move to favorably report the resolution authorizing the President of the Senate to certify the report of the Committee on Health, Education, Labor, and Pensions of the Senate regarding the refusal of Dr. Ralph DeLatorre to appear and testify before the committee. The clerk will call the roll.
Senator Murray? Aye. Senator Casey?
Aye by proxy.
Senator Baldwin?
Aye by proxy.
Senator Murphy? Aye. Senator Kane? Aye. Senator Hassan? Aye. Senator Smith? Aye. Senator Lujan? Aye. Senator Hickenlooper? Aye. Senator Markey? Aye. Senator Cassidy?
Aye.
Senator Paul?
Not voting.
Senator Collins?
Aye by proxy.
Senator Murkowski?
Aye by proxy.
Senator Braun,
Aye by proxy.
Senator Marshall,
Aye by proxy.
Senator Romney,
Aye by proxy.
Senator Tuberville,
Aye by proxy.
Senator Mullen, Senator Budd,
Aye by proxy.
Chairman Sanders.
Aye.
I have 20 ayes, 0 nays.
The ayes have it. The resolution is agreed to and will be favorably reported. All right, that ends the votes. Thank you all for being here. If anybody wanted to make any brief statements, please do. Any statements? Okay, with that, the committee stands adjourned. Thank you all for attending.